Hi everyone, welcome back to Medical YouTube channel. Today we're diving into clinical skill in sports medicine, hip dislocation reduction techniques. So a dislocated hip is a serious injury, often seen in high impact sports such as football and trauma such as car accident. If you're in the medical field, you know reduction of dislocated hip, it's not for everybody. Okay, it's physically demanding. However, with the right technique and practice, you might be able to reduce it. Okay. All right, so let's get into it. Now, let's go through 5 common reduction technique used by emergency room or orthopedic doctor. All right. So first one is called Alice maneuver. Okay. For this one, the patient lies flat on exam table, and then the provider flex the hip and knee to 90 degrees and apply steady inline traction pull. And the assistant can be helpful to hold the hip, the pelvis for the down force. Okay, and the femoral head is guided back into the place. So that's the technique. Next one is the one I like, Captain Morgan technique. Okay, you know why it calls that if you see the video. This one is about using your own leg as a fulcrum, and the patient is fine with their knee bent, and the provider place their own knees under the patient's knee and applies upward force while stabilizing the pelvis. This technique helps minimize excess strain, stress on your back, and you can do by yourself. And I really like this one, and the video you see on the corner, I'm using my creation hip dislocation simulator and doing the Captain Morgan technique like the TV drama Pit. Okay, next one is the Whistler technique. Okay, so this one, the provider places their arm under the patient's affected knee and while stabilizing the foot, and then apply gentle downward traction and at the ankle while performing slight internal and external rotations. This can be helpful for cases needing extra rotational movement. And next one is East Baltimore lift. I don't know the name of it. This one is crazy. Okay, so this one requires 2 clinicians. They stand on either side of the spine patients and then interlocking their arms beneath the knee of the affected leg. And by applying an upward lift together, the femoral head is guided back into places. To me, this is Captain Morgan technique, okay? In my opinion, I'm just saying. I mean, it doesn't need 2 people, okay? Next one is Stimson gravity maneuver, okay? So, all right, finally, we have the technique where gravity does some of your work, a little bit, not too much, I think. Okay, so the patient is prone on the bed with their leg hanging off the edge. And then the provider applies gentle downward pressure on the leg while performing subtle manipulation, okay? This method is less physically demanding because of the position, but you need to have a patient cooperation. Okay, all right. So there you have it. 5 techniques to reduce the hip dislocation, but you need to remember proper training and technique are key to avoid any kind of complications. Okay. If you're a medical professional, practice this method if you can to be prepared when it counts, okay? What is your goal to hip reduction technique? Drop a comment below, and if you found this helpful, Don't forget to like, subscribe, and hit the bell icon for more medical simulation content. If you're interested in purchasing any of our products such as shoulder, elbow, and finger dislocation simulators, you can contact sales@techline.com. Sales@techlinetrauma.com. So, until next time, stay injury free unless you are practicing on Jenny. Thank you.